Drug use by young people continues at a steady climb, with more and more teens becoming addicted. Emergency Department Dr. Mike Ritter of Children's Hospital of Orange County sees firsthand the danger that this presents to both the user and the community.
GnRx is a term that's used to describe the addiction to prescription medications that we see in teenagers and young adults. You've heard the term Generation X to describe that generation, but now we use that term because there's so many people that are getting addicted to prescription medications, and a lot of the times they're not their prescriptions. So they're getting prescriptions illegally on the internet. Another phenomenon that we've seen and experienced is teenagers using debit cards to purchase these drugs online and then have them shipped to them FedEx or UPS. The kinds of prescriptions that we're seeing abused are typically things that'll get you stoned. So the first category is narcotic painkillers. So Tylenol with codeine or Tylenol number 3s, Vicodin, Percocet, OxyContin. Those are narcotic painkillers that you can take to get stoned. The other category of medications that we see abused are the muscle relaxers, such as Valium, Ativan, Soma, and all of these drugs are addictive, and so kids take them to get stoned, and next thing you know, they've developed a physical dependence and addiction to these medications. Probably the age group that you first start to see abuse of prescription drugs is in junior high. And I know that seems really young, and a lot of parents are shocked to hear that, but we see kids at the junior high level get a hold of medications and start abusing them. And those kids are usually not buying them off the internet, but they're getting them from their parents out of their medicine cabinets. Some of the non-prescription drugs that we see abused by kids, there's marijuana, which has been used for many, many years. Ecstasy is a new drug. People have heard the term. Most parents don't realize that ecstasy is really just a derivative or a different form of crystal methamphetamine. So a parent might be horrified to hear that their kid's abusing meth or crystal meth. So the first thing to do is education. Talk to your kids that these drugs are physically addictive, that the addiction to Vicodin is no different than the addiction to heroin. They're both bad and they're both difficult to get off of, and they can both get you in a lot of trouble. I think the other thing to do in terms of talking to your kids about this is to talk about some of the hazards associated with drug use, such as going to jail. These are felony offenses for kids, and so you might wind up in juvenile hall. There's sexual assault that happens in jail, and this will definitely get teenagers' attention when you bring up these topics with them. I always tell parents, I think it's okay to look in your kids' rooms. I know you want to give them autonomy, but they are not living on their own. They're living in your house, and you need to go in there and make sure that they don't have drug paraphernalia, and you need to set limits. Most of the kids that have these serious drug problems are at the age where they drive. So the first thing you need to do is say, if you're going to use drugs, we're going to take away your car, and you can just take the bus everywhere. The car is the most important thing, and once a kid has that or has the ability to drive your car, limiting that is a very powerful tool. In more advanced cases where you can't talk to them and you cannot convince them and they continue to use drugs despite restrictions or other pleasure items taken away from them, is to seek professional drug counseling.